A new study has raised concerns that current definitions of vitamin B12 deficiency may be inadequate, potentially leaving many older adults at risk of cognitive decline despite meeting existing nutritional guidelines. The research, conducted at a leading university and published in a prominent neurology journal, found that individuals with lower levels of biologically active B12 exhibited slower cognitive processing speeds and more pronounced white matter lesions in the brain. These findings suggest that B12 insufficiency may affect neurological health even in those whose levels fall within the established normal range, prompting calls for a reassessment of vitamin B12 recommendations and increased attention to its role in brain function. For decades, vitamin B12 has been recognized as an essential nutrient crucial for DNA synthesis, red blood cell formation, and the maintenance of nerve tissue. Deficiency is well documented in cases of pernicious anemia and certain neurological disorders, but its subtler effects on cognitive performance have remained underexplored. The latest research suggests that mild to moderate deficiencies, often undiagnosed due to rigid threshold definitions, may contribute to age-related cognitive impairment and an increased risk of neurodegenerative diseases. The study followed a cohort of older adults without a prior diagnosis of dementia or mild cognitive impairment. Participants underwent a series of cognitive tests assessing processing speed and reaction time, in addition to MRI scans to evaluate brain structure. Despite having B12 levels above the official deficiency threshold, those in the lower range of the normal spectrum showed significantly slower cognitive responses and increased damage to white matter, the nerve fibers responsible for communication between different regions of the brain. These changes, though not immediately disabling, could represent early markers of cognitive decline and increased vulnerability to conditions such as Alzheimer's disease and vascular dementia. One of the most concerning aspects of the study was the association between lower B12 levels and the accumulation of white matter lesions. These lesions, which appear as abnormalities on brain scans, are linked to impaired neural connectivity and a higher risk of stroke, dementia, and other neurological disorders. They develop when small blood vessels in the brain become damaged, leading to reduced oxygen and nutrient supply to nerve cells. While aging and cardiovascular conditions are known contributors to white matter deterioration, the study suggests that B12 insufficiency could be an additional, modifiable risk factor. The findings challenge long-standing assumptions about what constitutes an adequate intake of vitamin B12. Current guidelines are based primarily on preventing overt deficiency symptoms such as anemia and severe neurological dysfunction. However, they may not take into account more subtle but clinically significant effects on brain health. This discrepancy highlights the need to shift from a purely numerical threshold toward a functional assessment of B12 status, incorporating biomarkers that reflect the vitamin's availability at the cellular level. Unlike other essential nutrients, B12 absorption is a complex process that depends on the proper functioning of the digestive system. The vitamin is naturally found in animal-based foods such as meat, fish, dairy, and eggs. It requires a protein called intrinsic factor, produced in the stomach, to be efficiently absorbed in the small intestine. Aging, along with conditions such as atrophic gastritis, Helicobacter pylori infections, and long-term use of medications that reduce stomach acid, can interfere with this process, leading to suboptimal B12 levels even in individuals who consume sufficient amounts through diet. The issue is particularly relevant for older adults, who are at greater risk of developing B12 insufficiency due to decreased absorption capacity. Compounding this problem is the fact that B12-related neurological symptoms often develop gradually and can be mistaken for normal aging. Subtle cognitive changes, including reduced processing speed and mild memory difficulties, may go unnoticed until they become more pronounced. By the time a deficiency is formally diagnosed, significant neural damage may have already occurred. The study's authors recommend further investigation into whether routine B12 supplementation could help mitigate these cognitive effects in older adults. While high-dose supplementation is already standard for those with diagnosed deficiencies, the potential benefits for individuals with lower but technically normal levels remain an open question. If further research confirms that even mild insufficiency contributes to cognitive impairment, it could lead to a reevaluation of recommended dietary intake levels and supplementation guidelines. In addition to cognitive effects, inadequate B12 levels have been linked to other health concerns, including increased homocysteine levels. Homocysteine is an amino acid associated with inflammation and an increased risk of cardiovascular disease. Elevated homocysteine is often found in individuals with low B12, further strengthening the argument that optimal B12 levels are necessary for overall health, not just for preventing anemia. A broader reassessment of B12 guidelines would align with emerging research suggesting that optimal nutrient levels for long-term health may differ from the minimum required to prevent acute deficiencies. Similar debates have taken place regarding vitamin D, where evidence suggests that levels once considered sufficient may not provide the full range of protective benefits for bone health, immune function, and chronic disease prevention. The potential public health implications of these findings are significant. If subclinical B12 insufficiency contributes to cognitive decline in older adults, identifying and addressing it early could help reduce the burden of dementia and other neurodegenerative diseases. Given the rising prevalence of cognitive disorders and the economic and social costs associated with their management, preventive strategies focused on modifiable risk factors like nutrition could play a crucial role in promoting healthy aging. For individuals concerned about their B12 status, dietary choices and supplementation strategies should be tailored to their specific needs. While animal products remain the richest sources of B12, those who have difficulty absorbing the vitamin due to age-related factors or medical conditions may benefit from fortified foods or supplements. Sublingual B12 and intramuscular injections are often recommended for individuals with absorption issues, as they bypass the digestive system and deliver the vitamin directly into the bloodstream. Healthcare providers may need to reconsider how they assess B12 levels in clinical practice. Instead of relying solely on total serum B12 measurements, additional tests such as methylmalonic acid and holotranscobalamin, which indicate active B12 status, could provide a more accurate picture of functional deficiency. These markers reflect how effectively B12 is being utilized at the cellular level, offering a more nuanced assessment of whether supplementation might be beneficial. The study underscores the importance of a proactive approach to nutritional health, particularly in aging populations. While widespread B12 deficiency is rare in developed countries, suboptimal levels may be far more common than previously recognized. By shifting the focus from merely preventing severe deficiency to optimizing levels for brain health, researchers and clinicians may open new avenues for maintaining cognitive function and reducing the risk of age-related neurological decline. Future research will be needed to establish definitive guidelines on what constitutes an optimal B12 level for cognitive health. Long-term studies examining whether supplementation can prevent or slow cognitive decline will be crucial in determining whether current recommendations need to be revised. Until then, older adults and those at risk for B12 insufficiency should consider discussing their levels with a healthcare provider and exploring dietary or supplemental options to ensure they are maintaining adequate stores of this vital nutrient. As scientific understanding of nutrition and brain health continues to evolve, the role of vitamin B12 in cognitive function is becoming increasingly clear. This latest research highlights the potential dangers of relying on rigid, outdated definitions of deficiency and underscores the need for a more personalized, functional approach to nutrient assessment. With an aging population and a growing emphasis on dementia prevention, ensuring optimal B12 levels could be a simple yet effective strategy for supporting lifelong brain health. This groundbreaking study challenges what we thought we knew about vitamin B12 and brain health. Even if your levels are technically normal, they might not be enough to protect against cognitive decline. With aging, absorption issues, and the rising risk of neurodegenerative diseases, it's time to rethink B12 recommendations and consider whether more people, especially older adults, should supplement. If you're concerned about your brain health, check your B12 levels, talk to your doctor, and make sure you're getting enough from food or supplements. Small changes today could make a big difference for your future. For more updates on the latest in health, nutrition, and longevity, don't forget to like, subscribe, and turn on notifications. Thanks for watching.